Welcome to our Child and Infant CPR class presented by Howard County Department of Fire and Rescue Services. So what is sudden cardiac arrest? This is when your heart suddenly stops pumping blood. Prior to this happening, there are no warning signs. So the person is just going to collapse suddenly, they're going to be unresponsive, they will stop breathing, and they will not have a pulse. Now, out of those three criteria, you are going to check for two, and that's going to be consciousness or responsiveness and breathing. You no longer need to check for a pulse. Through a lot of various studies, it was found that it's very easy for people to mistake their own pulse in their fingertips for that of the individual. And that mistake could prevent you from beginning CPR on somebody who actually does need it. Now, one of the signs that we have discussed so far is that the person stops breathing. Well, there's something called agonal breathing that can occur, and this can make it a little more challenging to determine if the person has actually stopped breathing. So when you breathe every day, you don't have to actively think about each breath you're taking. Your brain is able to keep that mechanism going for you without your conscious thought. When someone has gone into sudden cardiac arrest, for a period of time, their brain is still going to tell their lungs to breathe, but their lungs are unable to do so. So the lungs begin gasping, trying to bring air into the body. It's just unsuccessful. But this gasping can create a strange sound. It's often described as gurgling, snoring, even grunting. So if we hear this sound, we can automatically say that the person is not breathing. They are not able to move adequate air in and out of the body. Now, this is not always going to be present, but if it is, we want to be able to recognize it. Our first section, we are going to talk about how to perform child CPR. Now, a child today in this video is going to be referring to anyone ages 1 to 7 years of age. You will have to use your best judgment if you don't know the age. It's not that big of a deal if you treat a 7-year-old as an adult or, like an 8 or 9-year-old as a child. We just want to make our best guess. You can also use weight when determining to treat as a child or adult. So around the 65 to 75 pound mark is when we can start to treat as an adult. If you're interested in learning about adult CPR, we do have another video. It is called Hands-Only CPR, and that will go in depth into how to treat CPR for ages 8 and up, as well as using an AED. So I do recommend you check that out. Now, one of the biggest differences between adult CPR and child CPR is rescue breaths. So many times when children and infants have gone into cardiac arrest, it was because of a respiratory problem. So for whatever reason, the child could not get enough oxygen into their body, and eventually without that, the heart is going to stop. So because the cause could have been lack of oxygen, we do want to try our best to get oxygen into their body as soon as we can. And that's why we are going to now start delivering rescue breaths. So a lot of these steps for child CPR are going to be very similar to our adult CPR. There's just now the inclusion of rescue breaths. So my first C stands for check. So we have to figure out if anything's even wrong with the child. First part of this, we do want to try our best to lay the child on a hard, flat surface. Now you have to do the best you can in whatever situation you find yourself in. If you can't do this, if you can't get them down on the ground, if it's a small space, whatever the case is, just do your best. But if you can't get them on the hard, flat surface, that's okay. You're still going to continue your steps. We then need to check for responsiveness. To do that, we do a tap, shout, tap sequence. So we're going to tap their shoulders, ask, "Are you okay?" and then tap their shoulders again. We are looking for any kind of response here. It does not have to be verbal. So if you tap their shoulders and they open their eyes, they kind of look at you for a few seconds and then close them again and they appear unconscious, that is a good sign in terms of their heart's working because they were able to respond to you. Now, that's not to say there's not some other type of medical emergency happening, so you should still call 911 in that case. But since they could respond, you know their heart's working and you don't have to start CPR. Once I've checked for responsiveness, if I didn't get anything, I then need to check for breathing. To do that, we're just going to look at their chest for 5 to 10 seconds, and we are looking for signs of breathing. So some indications that they are breathing are going to be chest rise and fall, and that should be relatively rhythmic. And or we're going to hear the agonal breathing and we can automatically say they're not breathing because we know that strange sound is an indication of that. So you can determine they are not breathing either by no movement, or we can hear this strange grunting, gurgling, snoring type sound. Now that we've checked them, we know they're not responsive, they're not breathing. We then need to call 911. So you can either do this yourself or you can instruct somebody else to. This is also the point that you're going to want to send somebody to try and find an AED. For more specific information about what AED machines are and specifically how they work, you can refer to our adult video, the Hands-Only CPR. For our hands placement on a child, we're going to place the heel of one hand in the center of their chest. That's going to be about nipple line for them. We're going to press down into their chest about 2 inches, and we want to go at a rate of 100 to 120 times every minute. So it's almost 2 a second. We are going to count out 30 compressions. After we've done 30 compressions, we are now going to perform 2 rescue breaths. So for a rescue breath, we first have to open their airway. To do this, we are going to take one hand on their forehead. Using your other hand, your 2 fingers, you'll place that on the bony part of their chin, and you will tilt their head back. Now you're not hyperextending it. It is a pretty small movement. You are essentially bringing their chin line perpendicular to the ground here. You are then going to pinch their nose closed, and you can do that using your index finger and thumb from the hands on their forehead. You're going to create a seal around their mouth using your mouth, and then you will deliver 1 rescue breath. Now, while you're delivering that rescue breath, it should be pretty gentle. You're not putting a lot of force behind it. And as you're doing that, you want to try to look at their chest. As soon as you see the chest begin to rise up, that is enough breath. You can then release your mouth. The air is going to automatically be exhaled, and you'll go ahead and repeat for your second breath. Now, when delivering a breath, it's a gentle movement. It should be pretty steady, but it's not a long period of time. It's about 1 to 2 seconds. So it should not take a lot of time. That is how it should be done if you're doing it correctly. Once I finish my 2 rescue breaths, we're going to repeat that cycle. So we'll start with 30 compressions again, and then we'll switch to the 2 rescue breaths. And you're just going to continue going back and forth until an AED arrives or EMS providers get on scene. Now, because children are so much smaller, it is going to be easier to do a compression on them versus an adult. So you now have the option of doing either the two-handed CPR that we see here, and that's how it was described in the hands-only video for adults, or you can use just one hand, and you can see that in the second picture. Now, if you're using only the one hand, you do have the ability to keep their airway open as you're switching back and forth. So instead of doing 30 compressions and then having to reopen their airway or tilt their head back every time, I can do that the first time and then leave my hands on their forehead. And that's going to just make it a little bit easier when I'm switching between compressions and rescue breaths. However, either way is perfectly acceptable. It is easy to open the airway, so it's not a big deal if you do have to use your 2 hands. This is completely up to you, what you're comfortable with, what you feel you can handle in the situation, but just know that there are those 2 options available. All right, we are now going to watch just a short video demonstration. There is no sound, so I'm just going to kind of talk through what we are seeing. So we're going to open their airway. So we can see he's taking forehead with one hand, 2 fingers on the bony part of the chin, and we can see just how small of a movement this is going to be. So it's not a big movement, and he's not hyperextending the neck. This is really just opening up their airway as big as we can get it. He's now going to pinch the nose closed tight, creating that seal. And it's a very short breath. That's only about a second, and you can see the chest rises. After those, 2 rescue breaths, he would immediately go into performing 30 compressions again. Now, for children and using an AED, it is very similar to our adults. The only difference is going to be using the child or pediatric size pads. Typically, those are going to be smaller in size, and instead of the blue backing, which adult pads are on, it should be on a pink backing, or it'll have pictures of pandas all over it. But either way, they will be labeled in their respective pouches or like little bags that they come in. So just make sure you're reading, and you're going to grab the pediatric size pads. Now, if you have access to those child pads, everything is the exact same as when we're doing this on an adult. So my pad placements go in the same place. One will go in the upper right-hand corner of the chest. The other goes on the left lower side of the chest. And it really is the side, it's underneath where your arms would be if they were next to you while you're standing. You then plug the pads into the machine, and it'll cycle through. So it'll tell you, analyzing the heart. It'll take you down whichever pathway, shock advised or no shock advised. After it's completed that, it does tell you to continue CPR and rescue breaths. Now, let's say for some reason you don't have access to child pads or pediatric pads. You can use adult pads on a child. However, we have to change the placement of those pads. And this is something you just kind of would have to remember. There's not going to be anything in the AED that's going to say this. So using adult pads on a child, we are going to take one of the pads. It does not matter which one. We place it right in the center of their chest. So your hands while doing compressions would have to go on top of this pad, and that is okay to do. You don't have to remove it. My other pad is going to go on the back of the child in the center, just ever so slightly off to the left. It's really a tiny amount off to the left. It's really just about center of their back. So that way you still can use the AED if you don't have those child or pediatric size pads. If you are looking for more specific information about an AED, go ahead and check out our Hands-Only CPR video. The very ends of that video, there's a really in-depth look at the AED, specifically what it does, where you can find them. There's a few situations that might change the way you use the AED. So I do recommend you go check that out if you haven't already. All right, so our next section is going to be infants. An infant is going to be under the age of 1. Now, a lot of these steps are going to be very similar to our child CPR, but there are a few differences. So for my check portion, I do want to still get the infant on a hard, flat surface. The difference here is it's going to be more beneficial for you if that hard, flat surface is elevated. So, a table, a counter, a changing table is a really good option as long as you've removed the pad. Anything that's hard and flat and elevated. The reason we want to elevate is it's going to be a lot easier for you to be able to do compressions and rescue breaths if it's just up higher, if the infant is up higher versus on the ground. So once I've done that, I am going to check for response. I'm still using my tap, shout, tap sequence. However, I'm now going to tap the bottom of their foot. And I don't necessarily have to say, are you okay? Just some sort of verbal stimuli, baby, baby, or their name, something like that. But some type of verbal stimuli. And then we will tap the bottom of their foot again. Again, this is any kind of reaction. It does not have to be like a verbal sound. If they pull their foot away when you tap the bottom of it, if they open their eyes, something like that, that's a really good sign that their heart's working because they could respond to you. After checking for responsiveness, we do check for breathing. Now, when checking breathing for infants, you want to pay attention more to their abdomen for the rise and fall motion versus their chest. Infants sometimes are called belly breathers because that tends to just be where their muscles are, the muscles that are used while they're breathing, because their chest muscles haven't developed well enough. So pay attention more to their abdomen for that up and down, rise and fall motion. Still be aware of agonal breathing. That can still occur in infants. And if we hear that sound, it's kind of easier to determine they're not breathing because we automatically know it by hearing that sound. Now that I've checked them, I got no response, they are not breathing, I'm going to call 911 or instruct somebody else to do this. Now for infants, you cannot use an AED, so you don't have to worry about that at this point. You're just worried about calling 911. For our compressions, instead of using our entire hand, we're only going to use our index or pointer finger and middle finger. And that will go in the center of the baby's chest, so right at nipple line. And we are going to press down into their chest about 1.5 inches, but we're still going to be at that same rate, so 100 to 120 times every minute. After performing 30 compressions, we have to do our rescue breaths. Now, rescue breaths are very similar to what we just discussed in our child section. The only difference is you are actually going to create a seal around baby's nose and mouth instead of just their mouth. The reason for that really just goes to their size again. They're so much smaller. It's a lot easier for you to get a good seal around their nose and mouth versus trying to, pinch their nose closed and get a good seal around their mouth to deliver that breath. While delivering that breath, you really do want to try your best to look at their chest. As soon as you see a sign of movement, it rising up, that is sufficient. You don't need to continue providing more air into them. It should still be a really gentle force. We're not blowing very hard when we're doing these rescue breaths. And it really is just about 1 second, maybe 2 seconds. It's a short amount of time. And then we are going to continue doing this 30 compressions to 2 rescue breath cycle until EMS arrives. Now, if you have a partner with you, you can switch after every 5 cycles. That's a little bit easier than switching every 2 minutes. 5 cycles is just about that 2-minute mark. It's just easier to switch at the start of a new cycle versus like halfway through it. Here we can see a demonstration of where our finger placement's going to be. So we're just using, the tips of our fingers right in the center of the baby's chest. Now you can see kind of in the background of this picture that they are keeping the baby's airway open by keeping their head on their forehead. And that is totally acceptable. You can do that. Just be aware of how much pressure you have in that hand on their forehead. Sometimes when people are in these situations, it's really scary. And we can sometimes start to tense up. So we don't want to start squeezing baby's head. So just try to be aware of that. If you are starting to feel really tense, things like that, it's going to be better just to release your hand when you're doing compressions and open the airway each time you have to go to rescue breaths. Let's go ahead and watch our demonstration here. So right now she is going to start her tap, shout, tap. So she's tapping bottom of foot, saying baby, baby, tapping the bottom of the foot again. There we saw her calling for help. Here she is checking for breathing. You can see she's scanning, the chest and the abdomen. And now she's going to begin her compressions. So we'll do 30 compressions here. We can see the depth, that's about 1.5 inches, and she's going at that rate 100 to 120 times every second. Now we do our rescue breaths. So we saw her tilt the head back, that's opening the airway, and then she created the seal around baby's nose and mouth. And then we start the process over again. So she's choosing not to keep the airway open while she's doing compressions. So she's not keeping her hands on the baby's forehead. It's totally another option. It's totally fine. To do whatever is comfortable for you. And we can see those rescue breaths are really only about a second. It is not a long period of time at all. All right, so thank you for watching our child and infant CPR video. If you do have any questions, please feel free to reach out to us. Use our outreach at HCDFRS.org, or you can give us a call at 410-313-2016. Have a good day.